fit in at school or socially because I can barely fit in a desk at school. They have special desks for me. I love to sing. I'm in my school chorus. I got so big that I couldn't take as deep breaths as I needed, and I just felt like an outcast, and I was very unhealthy, and I knew that if I didn't do something, I was gonna die.
Maria struggled with obesity since early childhood. She unsuccessfully tried diet and exercise programs for years. By the age of 9, she was 250 pounds. Dangerously obese by age 15, Maria had developed pre-diabetes and high blood pressure. It was time to make a change in her life.
She was tired of being overweight and being unpopular and just not being able to keep up with the everyday life. Maria did a lot of research on the computer for weight loss surgery, and she found Dr. Nadler, and Dr. Nadler led us to Children's.
Dr. Nadler is part of the Obesity Institute at Children's National Medical Center, which provides comprehensive medical care to obese children and families.
Maria's health risks before surgery were significant. She had gained nearly 150 pounds over 2 years and was starting to suffer from shortness of breath, inability to exercise, insulin resistance, or prediabetes. So we went into the surgery knowing that this was basically a last chance for her. Most patients will lose about 100 pounds, but the process takes about 9 months to a year.
I wasn't ready to lose my daughter. You know, she's 15 years old and she's my life. I wasn't gonna lose her.
At the Obesity Institute, Maria and her family found hope in the team approach to making weight loss a success.
So our team entails the surgeons, nurse practitioners who work with general surgery. We have nutritionists, we have psychologists, we have pulmonologists. It's tailored to each patient.
Giving her the new diagnosis of diabetes, even without any family issues, I think it's important for her to see a psychologist.
In terms of the way she's feeling about her family relationships or her mood or her struggle with her new diagnosis, this is a good opportunity to get that under control.
Surgery isn't just a one-time experience. We definitely want to see where they are beforehand and help them figure out what kinds of things they need in place to help them ensure success of the surgery, and then follow them through the long term to make sure that those supports and changes are in place.
This is a lifelong endeavor, and getting everyone involved, including the family, is really important for ultimate success.
Maria and her family met with her medical team several times over the months before her surgery to develop a personalized plan for getting healthy.
We look at every component of the child's life to identify any strengths or challenges that they might have, not just in terms of weight.
After months of consultations, Maria's surgery was finally scheduled, a laparoscopic sleeve gastrectomy.
In this procedure, we remove approximately 80 to 90% of the stomach. It also removes the cells in the stomach that we think are responsible for appetite. So not only does it limit how much you can eat, but it actually limits your desire to eat. When Maria first came to me, she was quiet, reserved, a little bit timid, and maybe without direction. But now you see her, and she's bright, she's glowing, she's, seems ready to tackle anything.
I feel healthier. I can walk farther. My ankles, which used to be the most painful things in the world, I can walk on them and I feel great. And I feel healthy.
She moves more now. She's always got a smile on her face. She's more outgoing. She's just very happy.
Today, Maria is no longer insulin resistant. She continues to struggle with her weight, but she is eating healthier and able to be physically active.
Every time I see Maria, it makes me smile because I'm so proud of her for how hard she's worked to get where she is today. She's lost a significant amount of weight, but it's really not about the weight, it's about being healthier.
Before surgery, I was very constricted. I couldn't live my life because I couldn't walk places. I felt embarrassed around people. I just couldn't do so many things that normal teenagers can do.
It's exciting to see these kids change. It's exciting to come into a point in their lives where they've struggled so much and that we can help them with one thing that they've struggled with so much.
What I hope for Maria is what I hope for all of my children. which is really that they get better from their diseases, but also that they become more whole and more healthy as a person.
The whole team, everyone has been wonderful here. I can't say enough about Children's Hospital.
The team at Children's National is incredible. They want to help you and they want you to succeed. I still have a long way to go, but I feel like I can do more. And I feel better doing it.